All right, good morning, everyone. Thank you for joining us for our special call, Finance, Audit, and Budget Committee, chaired by myself, Commissioner Terry. We're joined by committee member and presiding officer, Commissioner Shakira Johnson, and Commissioner Michelle Longspear should be joining us on the Zoom shortly. We do have a short agenda today. We want to spend most of our time talking about the Diversion Center update presentation, and then we do have one item from District 6, so we'll get to that in a second. And with us this morning is Mr. Kareem Martin from the Sheriff's Office. Oh, minutes. Yeah, let's do the minutes first. Thank you, Commissioner Johnson. All right, item 0275, that's the minutes from January 26th. Special call FAB meeting, and if there's no changes or edits, I'll take a motion from the floor.
I move to approve item 0275.
All right, I'll second. Seeing no further discussion, all in favor, raise your hand, say aye.
Aye.
Chair votes aye, motion carries. All right, thank you. All right, Director Martin, thanks for joining us. I think Fabio might be on his way, so
yes.
if he gets here, we'll just call him in. But we have the PowerPoint presentation on the screen. We've got the printout here. So if you would do us a favor, just introduce yourself for the listening audience, and then let's go through this presentation this morning.
Absolutely. Well, good morning, everyone. I'm Kareem Martin. I am the Administrative Division Director of Health Services at DeKalb County Sheriff Office. I'm also the medical liaison, and of course, addressing any kind of medical or mental health issues that face the agency. And so today, going into a little bit of the jail diversion for mental health and substance use misdemeanors, just going to go ahead and get started and jump right into our first slide, talking about some of the statistical data of DeKalb County Jail. And here we can see in 2024, we had about 17,000 arrests. 13,000 of those are misdemeanors. In 2025, 16,858 arrests and 14,614 are misdemeanor arrests. And so this graph shows us a little bit of our high utilizers that bring arrestees into the facility. So like, of course, DeKalb County Police Department, Sheriff's Office, Brookhaven, Dunwoody, Chamblee, Doraville, MARTA, of course, Atlanta PD, and then some of our other agencies, not as high, but do bring in a few individuals into custody. Going into some of our numbers and data, of course, DeKalb County Jail has and that should be in 2025, my apologies for that, but in 2025, our mental health population is 71% of our average daily population. Seems like a large number, but those individuals are all mental health diagnosed, on treatment plan, individualized treatment plan. And so 71% of the total population leaves us at 1,420 individuals that have a mental health or substance abuse disorder in custody. 52% of that 1,420, which is 738 individuals, have a misdemeanor, mental health individuals that have a misdemeanor. So at that time frame, 738 have a misdemeanor. We have 127 inmates pending DBHDD competency and restoration. And of course, a lot of this information will make sense as we go through the PowerPoint. But just pointing out a few pointers here, 32 individuals are pending state hospital crisis stabilization. And of course, that can only be done at a state hospital. If you are in custody and you're going through mental health crisis, Grady Hospital will not accept you. They would not admit you if you're in custody. Emory Hospital will not admit you're in custody. And of course, with the limited resources DBHDD does have, we do have a lengthy wait time to get those individuals, either for stabilization or competency evaluation. Once you're booked into the jail, inmates are under the care of the sheriff and the authority of the court system. And so, of course, all medical and behavioral health costs are paid by the sheriff's office. Treatment can only be performed on forensic units, which Grady and Emory don't have forensic units. And competency evaluation can only be done by Department of Behavioral Health and Developmental Disabilities. Inmates with a mental health diagnosis stay in jail twice as long and, of course, are in the community 29 fewer days between booking episodes, and more than 1.5 times more likely to be booked within the same year in terms of recidivism. And some of this information does come from the Criminal Justice Coordinating Council of 2022.
And Director Martin, just
Yes.
quickly in that last slide, for the 52% that had a misdemeanor charge, was that their only charge?
That's their only charge.
Okay,
Yeah.
gotcha, thank you. Yeah, let's go ahead and just, if you don't mind, go ahead.
Sure, I had a
Mr.
couple
Johnson.
questions on this slide. So when you said that the inmates have a mental diagnosis, are they coming in with that diagnosis, or are we doing that while they're in
A
custody?
little bit of both. So in the intake process, we do a behavioral health, a psych screening, as well as a medical screening. And so we're able to identify what medications you're on. We use SureScripts. And so a lot of the medications are psychotropic medications, which you have to have a psych diagnosis to be prescribed psychotropic medication. And so coming in, we have a lot of individuals coming in, but then we also do a lot of diagnosing in the facility. Of course, in your first 24 to 72 hours, you were treating depression, chronic depression, suicidal ideation, and then you have those that come in with a long-term chronic diagnosis of schizophrenia. Schizophrenia is probably around 30% of our population, right? And so if you look at our medication costs, we're looking at a high cost of psychotropic meds. I want to say in December, our medication cost was $390,000 for that month. Right, and so you're treating your HIV or some of your highest cost individuals. Some individuals come into jail and have never been treated, right? That's that marginalized population, that homeless population. At the time of this data, which was January of 2026, we had 199 homeless individuals, unhoused individuals in custody. Right, and so those individuals, we have to initiate their treatment. We have to initiate their individualized treatment plan, psychotropic medication for stabilization.
Okay, thank you for that. And then for, excuse me, the 32 inmates pending state hospital crisis stabilization, where is the state hospital?
Georgia Regional, any Georgia Regional Hospital, all throughout Georgia. And so those 32 inmates are completely decompensated, in a state of psychosis, right? They don't know, they're not alert to person, place, or thing, or time. They don't know their names, and so we can't force medicate. Georgia Regional can.
Got it.
And so you can get stable at Georgia Regional, but when you come to the custody, we can't force medicate, we can't force inject. So that's where that disconnect happens.
Okay, and then final clarification on this slide. That last one you were talking about, inmates with mental health diagnosis stay in jail twice as long, but are in the community 29 fewer days between booking episodes. Can you explain that a little?
So once you're mental health and you're in the facility, it's harder to get out because, number one, you have a bond, but you can't afford your bond. Number two, you have a bond, but you don't know you have a bond because you're so decompensated from a psych standpoint. And so, number three, your family doesn't want to bond you out because they feel like it's a little bit more safe to be in jail where you can be acutely managed versus just being out on the street. And so we happen to have them stay in custody a lot longer than your regular individuals that come in that have a bond.
So the fewer days in community is the outside
Yes.
community. Okay, understood. Got it. Thank you.
Yes, ma'am. So when we go into the jail costs, it's approximately $121 for one inmate per day. And that doesn't include your medical or your behavioral health services. The medical contract outside of that $121 a day is about $25 million to facilitate medical care in the facility. That's paying all your medical employees. That's matching the staffing to the daily average daily population. So, of course, now that we have over 2,000, we're going to have more nurses versus when we had 1,300. Average length of stay for inmates in custody are 331 days. And so, of course, inmates referred to a DBHDD competency program takes an additional 467 days. And so, of course, if a judge does find a client to be incompetent or question their competencies, you have to wait another 467 days before DBHDD gives you a bed. And so that's an additional 467 days that we're facilitating mental health psychotropic medications in jail. And so the estimated housing cost for an inmate is $40,000 on an average inmate and $96,000 for those inmates waiting for competency. And of course, that just goes into your wait time for a bed at DBHDD and your average wait time, your length of stay for the jail.
And is that, Dr. Martin, is it more because you're adding in the additional days, or is
Yes.
it more Okay, so that's because it's going over
Right.
2 years almost.
Yeah, that's just adding in the additional days. Now, we've had situations and issues where, and I'm sure our treasury or finance team can let us know, but our invoices for hospital admission has gone up for one patient like $3 million, right? And so when you get an inpatient hospital admission, we have to pay for everything out of pocket. Contracts with Grady does facilitate a little bit cheaper, and then we pay at the Medicaid rate. But if you have a patient that's going through chemo, that has schizophrenia, that requires psychotropic medication, from an inpatient setting, it is more expensive.
Gotcha. And then the $25.2 million for the annual contract for medical and behavioral health services, has that stayed about the same, or has that gone up in recent years?
That's gone up. Now, I want to say between a 4 to 5% increase annually.
Okay.
Yeah.
Is that because it's just more expensive to provide that care?
Yes.
Or, okay, so it's not necessarily the number of
No, it's
people.
just the care that we provide, yeah.
Okay, gotcha. Zach, did you have a question or comment?
I'm not sure. Did you say that we pay Grady? Is that what you said?
No, we don't pay Grady, but we do pay Emory.
Okay.
And so just depending on how acute the patients are, they have to go to Emory, but we don't pay Grady, yeah.
Okay, thank you.
That was after I found of, the Fulton DeKalb Hospital. Right. And so going into DeKalb County Jail, some more of the cost. Daily inmate housing costs, excluding mental health or medical services, like I said, is 121. And then, of course, you times that by the average daily population, 2,073. You get 250,000 a day. Annual inmate housing costs, of course, to facilitate all of that, excluding mental health and medical services, is just about $90 million a year. But when we talk about our misdemeanors with a mental health diagnosis on the average length of stay of 331 days, we're looking at $29 million. And so that is for the 738 individuals that are in custody that have a misdemeanor, such as criminal trespassing, that could have or can be diverted to a diversion center for treatment and stabilization versus going to jail. Number and cost of inmates pending competency, of course, 127. And so if you have 121 cost times 467 days, then you look at your average length of stay for those that are pending competency evaluation. And then, of course, the number of inmates pending stabilization, 1,281,632. And for those individuals pending stabilization, they don't necessarily have a competency court order. And so they are pending release. They probably have a bond, but no one to pay their bond again. They're so significantly decompensated that we have to facilitate them. And then once they get to a place where we feel that they're confident to be released, we have that conversation with the courts again to see if we need to have another bond hearing or what we can do to really settle their charges. But it's a whole process that we have to go through with the courts. And so when we talk about the diversion center with a emergency receiving facility, we talk about some of the criterias, nonviolent misdemeanors. And so, of course, police arresting agencies will all have the option to take individuals to the diversion center depending on their charges. Of course, nonviolent misdemeanors. Of course, 18 and up in terms of ages, multiple contacts with criminal legal systems are at high risk for recidivism. And so a lot of time what we see is Mr. John Doe is back again for criminal trespassing. Mr. John Doe is back again because he went back to the same place where he shouldn't have gone back. But it is from a mental health standpoint. He has schizophrenia, he has bipolar, he's having a manic episode, doesn't really know where he is, and just tends to go back to the same area. And so those are what we're trying to divert to the diversion center.
And Director Martin, I know, and Zach, I think this is something Director Mitchell has talked about over the years, but our HUD homelessness support money, if there is a mental health diagnosis, I believe that our HUD money doesn't go to support that population because of liability, because of risk of putting them, in a hotel room by themselves. And so it does appear that there's a significant number of homeless who have no other system other than the crisis system or the jail, and because they're not going to be picked up through our street outreach teams or even going to frontline shelter.
That's correct.
Is that my
That's
understanding?
correct, yeah.
Is that right? Okay.
A large percent of the homeless population also, homelessness and mental health kind of goes hand in hand. And so a large percent of the homeless population also has a mental health diagnosis. And so then they kind of get filtered through the system over and over. They get arrested. We try to treat and stabilize. Eventually, at some point, we do with our resources stabilize. They get released from custody, and they start the process all over again of getting arrested, coming back to jail. And so that's kind of what we're seeing that's kind of stopping up the criminal justice system.
Got it. Thank you.
So the diversion unit, of course, is voluntary. One of the things that the diversion center will also facilitate is the basic needs: your showers, your food, your physical and your mental health screening. They'll have providers there, psychologists, psychiatrists, LCSWs, licensed clinical social workers, to help facilitate and kind of get you back into society through housing, finding the appropriate housing program. We have partnerships with like Grady Act Team for treatment centers. We have partnerships with other treatment centers. So of course, once you pass your average length of stay in the diversion center for say 7 days, the possibility of going to a stabilization or treatment center, being treated here, or finding housing is a lot more. It's a part of your diversion center. And like I said, it refers to housing and treatment programs. The average length of stay is, or the average treatment is 20 persons per day, 20 people per day. The emergency receiving facility unit, of course, is involuntary, and that's when we go into our psychotropic treatment, our psychiatric treatment. That's when we go into our 1013s and 1014s. And so peace officers do have the option to 1013 someone. And, you know, you see someone that's having a manic episode, having a psychosis episode, instead of just taking them to jail, if you really want to get them treatment and kind of divert from the whole criminal justice system, you can take them to the stabilization center, the diversion center, to be stabilized.
And Director Martin, I think one thing that I've been made aware of over the years is that, you know, someone who might have a mental health diagnosis, they might have gone through the crisis center or through Claritel in the past. You know, our outreach teams will go and visit them and say, you know, look, we actually have some housing for you, and the individual says, you know, no, I don't want to go, and so residents will call the police and say, you know, this person is trespassing on the trail, for instance, and I believe what I've been told in the past is our police will not 1013 them unless there's a active crisis happening. And so when you think about a mental health condition that isn't manifesting in a crisis with someone who might be repeated criminal trespass. So an officer, you know, from DeKalb or some of our cities might say, well, you know, we can't 1013 them because they're not having a crisis, but they're also breaking this criminal trespass or loitering. And so there seems to be, I think, on private property, some compelling, I guess, policy that says we'll arrest them, and take them to jail. And then you are like, oh yes, we know this person. They do have a diagnosis, but they didn't have a crisis. And so that's just, to me, that was an interesting sort of, I guess, wall that you can't just 1013 anyone. But at the same time, you know, just because someone's not having a crisis, their mental health condition is in a way, I guess you said decompensate. That's an interesting way to put it. They won't even accept help because of that decompensation.
And
yes, Commissioner.
To add to that, I think the example you're referring to is they're not having an active crisis, but they're also not making good choices because it might be the heat of the summer and it might be dangerous for them to be out there, but they have that right to make the decision to not accept the help, but it still could be detrimental to their health. And so I feel it's frustrating to not be able to have something else that we can do, you know, outside looking in and not being that individual, knowing that we want to help them and they're refusing that help, but they're not in active crisis.
Very great points, right? And that's something that we experience all the time. And so one of the things that we do, and this is kind of where we wear that liaison hat with the courts, right? And so sometimes, yes, you have to be arrested. That's just the nature of the order. However, that's not the complete end of it. And so what we do is we have these conversations with the bench or have a conversation with the attorneys, the prosecution and defense, to let them know, okay, if we can get them out of jail, because sometimes they come to jail, they may have a bond or no bond, but we have to talk to them about treatment, or the judge wants treatment to be a part of their case, then we can say, okay, your release is contingent on getting treatment. And that's when it starts with your diversion center, your crisis receiving facilities, your treatment centers. And we can say, of course, if you have a bond, if you pay your bond, or your bond is contingent on going to the diversion center to at least initiate treatment. And so this can also be a part of this. We can have conversations with the bench or with the court and say, hey, this is also an option for you, for your cases, because you also have a huge backlog. And so if we can get some of these individuals with a misdemeanor nonviolent charges to be released from custody on a UJR or a SOR contingent on treatment at the diversion center, that's also going to help filter out our mental health population, and actually giving them the option, or not giving them the option of treatment, but making it mandatory that they start treatment. And then, of course, it'll be up to them as to if they're going to maintain it or not. And the diversion center is also going to be facilitating substance use treatment, right? And so when we talk about substance use, we also talk about homelessness, we talk about mental health. What we're seeing right now is DeKalb County going through an epidemic of fentanyl. And so a lot of individuals are now addicted to fentanyl and have to go through like a MAP program. And so we have the MAP program in the jail now. Claritel has a MAP program that they're developing, but the crisis center will also be that gap, bridge that gap for treatment, for substance abuse treatment, for alcohol use treatment as well. So this is kind of where we're going to start to change the narrative of society in DeKalb.
And Director Martin, let's dwell on this kind of point for a moment. So in your mind, and I think, in Claritel, this partnership that y'all have been working on, so there would be a pre-diversion component or a pre-arrest diversion component, but then also potentially a post-arrest component?
Yeah. The
Okay.
post-arrest component, that's something that, of course, we're still going to have to talk through, but it's available, and it's something that we should really look into to kind of facilitate treatment for nonviolent misdemeanors.
Okay. And I see Judge Jacobs has joined us from the state court. And actually, Judge, would you mind joining this conversation? Come on, just sit at one of the chairs there. Because I would like for you to share a little bit of what you're seeing in your courtroom, in the state court, when it relates to this particular demographic that we're talking about, and any challenges that you might see in terms of those individuals and how you handle their cases, and if there were opportunities to refer people to these types of programs outside of the jail, how that, is that something is welcome? Is it interesting? Is it something?
Absolutely. I mean, first of all, we do have a significant population that comes through with misdemeanor cases where they are indigent, homeless, with mental health and am I not? Yeah, it's on.
Okay.
With mental health and substance abuse issues where they need treatment, and as I've discussed with you individually, Commissioner Terry, certainly a multifaceted approach is important. Sometimes the situation can be addressed as part of the arresting decision. Sometimes a warrant's already been taken out and they're in the criminal justice system, and it's a matter of addressing their bond. Sometimes it's a post-accusation matter where we actually have a misdemeanor case in our court where we need to have a resource for that defendant to ultimately address their case and hopefully not find their way back into the criminal justice system. One caveat, and it's not a caveat that comes from the courts, it's a caveat that comes from the legislature. With regard to releasing a defendant on bond into a treatment program is that, and this is really just a thing that has happened, I would say, post-COVID in recent years. The legislature has greatly expanded the list of bail-restricted offenses to include many, many new misdemeanor offenses. And bail restricted means that whereas before, an offense was put on the list, where a judge would ordinarily be able to give them an SOR or UJR order and release them, on their own recognizance. Now we have to include as part of that sentence a monetary bond. There are many $1 bonds issued out of our court as a result of that law, and there are many defendants who can't even make that $1 bond. I am constrained, and all of our judges are constrained by the law that is given to us. I'm not going to comment on, I certainly have my thoughts about that expansion of that particular statute, but I'm not going to share it here in this meeting. Our job is to faithfully apply the law as the legislature gives it to us, and so there are many defendants who are even given a $1 bond where they can't make that bond, and they tend to be frankly, I've seen an example just within the past week of a defendant with severe mental health issues who has a $1 bond where we are constrained to issue a monetary bond in that particular case by virtue of it being a bail-restricted offense.
Okay.
So one thing I don't want to occur is to have there be an assumption that we can always release a defendant with a UJR into a treatment program, because sometimes because by virtue of that offense being on the list of bail-restricted offenses, we have no choice but to give them a monetary bond of some kind. We can still issue a special condition that they participate in a treatment program as part of their bond. And we also have a good pretrial services department that is run out of magistrate court, where that can even be judicially supervised, where we can have them come and check in with, in essence, an officer while they're out on bond to make sure that they are complying with treatment. But I just want to caution that that we're not always in every case, because of this ever-growing list of bail-restricted offenses, we are not legally able to issue a UJR in every case.
Okay, thank you for that context, Judge Jacobs. I think it would be good for us to, because I do remember that law passing, but I don't remember all the specific misdemeanors that are required for the, bail, nominal bail. So let's do some research on that just so we know, and that's maybe just an approach for us to, talk to the legislature. And this is for anyone that might know the answer, did they outlaw the bail assistance funds programs? Because I know at one point there were funds that were put up to help people pay for bails like that. I can't remember if they were outlawed or not. Does anyone happen to know? Marcus, can you look it up?
Sure.
Okay, all right. Marcus will look it up on the legislature's website, because I remember there was discussions. I think it was around Mother's Day. There was funds being created to bail mothers out of jail on Mother's Day, basically. But it required donations, and then the donations were received, and then they paid the bond.
I believe there have been some statutory changes that address that scenario in recent years.
Yeah.
It wouldn't be anything that I would touch as a judge, so it's not something I've paid as much attention to as this ever-growing list of misdemeanor offenses that are bail restricted, which is something that I have to deal with every day.
Yeah, but as far as you're concerned, if that $1 or whatever the bail is paid, then you're allowed to refer to a treatment program.
Well, we can always make a treatment program a special condition of bond.
Okay, got it. Thank you. Okay, perfect. Commissioner Johnson, any questions? Okay, all right, good. Director Martin.
Alrighty. Let's see. Receiving facilities, ERFs, of course, certified facilities by DBHDD can provide crisis, mental health, and substance abuse evaluation and services to individuals under an involuntary order. And of course, the facility would be a emergency receiving facility, right? And so we'd be able to do 1013s and 1014s, as we spoke about earlier, which requires a clinician or a physician to evaluate whether an individual is at imminent risk for harming themselves or others. And so once an individual is brought in, we can go through the normal process of stabilization or diversion or treatment or housing. But if we do find out they're a danger to themselves, we can 1013 them and keep them there longer for stabilization. And if I go back to the previous slides, at the bottom it talks about 16 crisis beds and 4 temporary observation beds. And these would be for the long-term individuals or longer-term individuals for stabilization.
Okay, so this would be in addition to the existing crisis center capacity?
Yes.
We'd want to have another facility that is in this diversion, but also could serve as a crisis. So
Right,
it's kind of got dual
exactly.
purposes.
Exactly. So this
Okay.
facility would have that dual purpose, will be a diversion center and a crisis stabilization center.
Okay. And I am reminded, we did take a delegation to Houston and San Antonio. You were there.
No, I didn't make it on that one.
Okay, so the
But I got all
Harris-
the information.
Okay, all right. So the Harris County Diversion Center, we toured that, and that was an interesting setup because I think their main thing was that they we know there's a crisis center sort of bottleneck, and then there was the diversion center, but then they also had a bottleneck with housing, and so that was something that I think Zach, I spoke with Chief Housing Officer Ferguson about is, with any future housing investments that the county makes, if we have, a goal of a certain number of units, that can be sort of the next referral. So it's kind of a pipeline or kind of a step process from don't go to jail, here's the diversion center, but the diversion center can't hold someone forever also. And so you need some place that kind of steps them back into society, but if there's not enough units available, then it sort of kind of again jams it up. So I don't want us to think about we're just like moving someone here to there, because that still is not a sustainable solution. It's good from I think what you're going to get into next in terms of just providing services.
Yes.
So that's very important because I think you make a good point. You can't you only have a certain capacity. And the capacity depends on how long someone stays there. So if someone's cycling out because they have another place to go, then it frees up that bed for the next person.
So I've gone to even the diversion centers down in Miami and some other states, and it really requires a effort in terms of coordination, right? And so housing from a community standpoint or a county standpoint has to be included. Just like Commissioner Tanner said, we're not just taking you from one place or stopping you from one process, but we also want to be able to connect you to other treatment and resources from the diversion center to other resources as well.
Okay, great, thank you.
Probable cause with a penal offense, of course, if a person is committing a crime or criminal offense at the time, peace officers have the discretion to decide whether to pursue criminal charges or pursue civil involuntary evaluation in custody, referring the individual to an emergency receiving facility. And probable cause without a penal offense, the peace officer has probable cause to believe that a person is a mentally ill person requiring involuntary treatment and consulted either in person or via telephone, telehealth, a clinician or physician, and a physician's authority for a peace officer to transport that individual for evaluation. And so basically, just like a little bit what we do now with DKPD, having a clinician right along with them, other agencies will have access to a clinician to call and say, hey, what are your thoughts? Can we consult on this case? Should they be sent to jail? It's not necessarily a violent act. It's a misdemeanor. It's criminal trespassing. Can we take them to the diversion center? They need treatment rather than custody.
Yeah, and I will mention Director Martin is interestingly enough, as I was driving into the office this morning, NPR, WAB was reporting about the suicide and crisis hotline not having enough capacity to even receive the phone calls. And so that was something that the legislature, I think, is talking about right now, of people, like, we created the new system. It's nationwide. Each state has their own sort of call center, but apparently they're not answering the calls in enough time. And even when you request a crisis unit, it could be
Sometime.
hours, and if not 24 hours. And I remember talking to one of the teams, and their response was, it's a big state, and we don't have the resources to cover, the entire state. Of course, in DeKalb, we have our own mobile crisis team within DeKalb Police Department. But Zach, I think even then, they're not 24/7, 365 coverage. So the clinicians only work certain shifts. So there are still some gaps even within our own crisis response, first response, really.
Right.
And again, that kind of gets me to sort of the concern that, we're really interested in diversion programs, but if an officer doesn't have that clinician with them or doesn't have the capacity to, to do the evaluation, then they might just come to jail as the result.
Yes, but one of the things with the diversion centers, they will have clinicians for you to consult with. And so the diversion center is going to be built with licensed clinical social workers that you would have to do a 1013 or 1014, a physician, because you would have to have that receiving screening. They will also have either a psychiatrist or a psychologist to do that mental health evaluation, because that's also going to be a part of each screening coming in. And so you can reach out to the diversion center for consultation to see, is this appropriate to bring to the diversion center? We'll have phone calls, just like how you have phone calls to the crisis centers now, to say, hey, we're going to bring this individual in. You can call the diversion center to consult as well.
And
So,
are those
good point.
24/7, 365?
Yeah, so this would be a 24/7 facility.
Okay.
365 facility, 24/7 around the clock. Arresting agencies all throughout DeKalb County will have access to say, okay, we're going to take you to the diversion center.
Okay, great, thank you.
So we talk about our operating cost comparison. We talked about a number specifically earlier, $29 million, and that's referencing the 738 individuals in custody currently with a mental health diagnosis that only have a misdemeanor. And so that number is referencing those individuals. And so if we're able to offload, for example, the maximum, which is 738 individuals, to a diversion center, ideally we'll be saving just about $29 million annually from the jail cost to facilitate this.
And again, is that just to help us understand the cost? So there is the housing cost of just how y'all sort of deploy staff, personnel, I guess repairing units probably. But then it seemed like the medical treatment is a huge cost, and so that's the big piece of this, is you're shifting it from only jail funds can be used for services, but then if you're at the diversion center, it's the medical treatment is a big part of that cost.
Yes, yeah, the medical treatment is a huge part of that cost, and so when you're in custody, you're right, we have to facilitate all costs from a medical standpoint. But that's everything almost from an inpatient setting. We don't have the option to really cut it down to say, okay, you only need this. You have to be facilitated with everything, because access to care in the jail is something that everyone has to experience. And so access to care is mental health, medical, dental services. You don't necessarily have to facilitate that in a diversion center. You have to facilitate treatment. So we identify what the specific treatment that patient needs and attend to that treatment, versus in the jail allocating for all access to care. Insurance and Medicaid can be billed at the diversion center. We can't bill insurance once you're in custody. Everything is full cost. Treatment systems, average length of stay is 7 days in the diversion center, 7,120 diversion units clients, which equals to 20 individuals a day. Daily cost is $350 per visit, which is a $2,500,000 annual cost. 936 clients in the emergency receiving facility treatment per year. So in a calendar year, we'll see just about 936 individuals, which facilitates more than our 738 misdemeanors in custody. And so with the 936, you have just about $4,900,000 in housing and treatment costs. And so the difference of cost from a diversion center from a jail is wide. It's, substantially different. And so we'd be able to, number one, offload the mental health services, the backlog, the bottleneck from a criminal justice standpoint, while giving them appropriate treatment, while giving them an opportunity to facilitate housing, an opportunity to facilitate psychotropic medications if necessary, getting you connected to a treatment provider in the community. Because like I said earlier, not everything will be done at the diversion center. The diversion center is almost like a triage for additional resources. And so substance use disorders treatment can start at the diversion center, and we connect you to a substance use provider in the community.
Okay, Commissioner?
Question, just want a little clarification. I know the 738 is the number that we had in 2025 of the inmates with those conditions. Is that kind of representative of an average over the last few years? Is that higher or lower? Like, I'm just curious to make sure that 936 could,
It's increasing.
it is increasing.
Yeah, it's
So
increasing.
okay.
Our average daily population, when I started in 22, was just about 1,300,
Okay.
right? And now our average daily population is over 2,000. And so it's over the years, over the last 4 or 5 years, it's increasing steadily, but increasing.
So currently, we would have, that 936 would meet the capacity that we need, but the number could be getting closer and closer every year.
Yes.
Okay,
Yes, absolutely.
understood. Thank you. I yield.
Okay, great question. And then the 4.9 million for housing and treatment costs, so that's housing them actually at this new
Treatment,
diversion emergency receiving facility. And I think one thing that we might want to try to scope out, Zach, is sort of like Houston, Miami that have diversion centers like this. What are they spending on the housing sort of in the referral situation? So, again, like if the county's going to do a big, housing investment this year, if we knew sort of, okay, it might be a few million annual to refer these individuals to sort of specific transitional supportive or even permanent supportive housing units, just kind of understanding that annual cost, I think would help us, plan ahead. Because I think the key thing, Zach, in my mind is, we want to create that treatment, pipeline where there is a place for someone to go and they don't get bottlenecked at one, segment along the pipeline.
So
Yeah.
the 7.4 includes the housing and, this is all in cost?
Yes, the 7.4 would just be for the facility, right? And so the maximum time you can stay in the facility is 7 days. It doesn't include anything outside the facility. Now, of course, individuals won't necessarily need all 7 days, and some
Like, it's
individuals will.
essentially like a crisis stabilization unit?
Yes. So the diversion center is going to be a diversion/crisis stabilization unit, which is why it would be also a emergency receiving facility. And so a lot of other different communities or counties may have a diversion center and a crisis stabilization center, emergency receiving center that all have to operate differently. But once you come here, you can meet all services. And then if you need crisis stabilization, you'll be able to stay here longer. If you need to be 1013 for psychotropic medication treatment therapy, we can 1013 you and treat you here versus sending you to other areas. And then we can provide that resources for housing. Are you getting ready to be discharged? Do you need to be connected to a provider in the community? What does that provider look like? Can we actually get you that first appointment before you leave here? A lot of that stuff is going to be done at the diversion center.
Yeah, thank you for that context. And so, Zach, I think this is hopefully the opportunity for us to kind of merge different challenges that we're facing in the county related to homelessness, and as well as, at the jail, and the mental health component, as well as housing. And I think we've seen kind of like just the general kind of high-level plan for the Peace Baptist Church site that Frontline has been working on. And I think most commissioners have seen sort of the general concepts of how to redevelop that entire site into like would be sort of a campus of sorts. And so the thought here is, if
maybe
we
having this asset on that type of a campus.
Yeah, I mean, that was my first thought, because, I think the idea here is the idea of a campus, and we saw this in Houston and San Antonio, is when you have a lot of providers and services and sort of those layers of services all in one location, there's a cost savings, because it's just people, one, are there talking to each other, but two, there might be some duplication of services or, that are happening elsewhere. You merge, and all of a sudden you've got some synergies happening. But also just trying to think about sort of different funding sources. And so, when it comes to how we pay for the diversion center, the SPLOST 2 funds for mental health and physical health facilities, any philanthropy that might be, in the works for the larger, system, hopefully kind of gets us in that mindset of how can we actually fit everything together. But I think also the other thing, the main thing that came out in my mind for the Peace Baptist Church site is that it's right off the interstate. It's very accessible. It's sort of centrally located. So from just a big county perspective, and how do you find something that's centrally located, the jail is right in the center. But one exit down is, the Covington Highway exit where Peace Baptist Church is.
Absolutely.
Yeah.
I think that's a phenomenal plan. One of the things that I do also want to mention is inmates with mental health and substance use disorders place in an increased strain on the jail resources. DeKalb County Jail is the #1 psych provider in the state of Georgia, right? And so that way we are facilitating more psychotropic services. I have a full-time psychiatrist. I have about 8 or 9 full-time LCSWs that are working around the clock, 2 nurse practitioners. All of this resources is going into trying to facilitate appropriate health care and psych treatment in the jail. One of the issues is the jail is not a treatment center. So how can you be the #1 treatment provider but not be a treatment center? We talk about our hands are tied when it comes to patients decompensating because we can't force medicate. A lot of the patients need forced medication because they don't know who they are, where they are, what medication they're on. They have to be stabilized. And being at a therapeutic level from medication brings you that stabilization. After that therapeutic level, you're then able to make appropriate choices, decisions on your own as an individual, entering back into society. And so that's a little bit of what we're seeing now in today's world, where the jail is overran and a little bit bombarded with mental health needs. Of course, we have longer stays, higher recidivisms, and increased treatment and housing costs. Right now, the jail has a medical infirmary, a psych infirmary, a medical step-down unit, a psych step-down unit, satellite clinics, and it's still not enough to facilitate mental health needs in the jail. Existing Georgia laws allows for alternative options of diversion centers, just like Judge Jacobs just reviewed. Diversion centers with emergency receiving facilities are more cost effective. There are diversion centers, and I think we saw some either in Texas or Miami, that they're actually not emergency receiving facilities, they're just diversion centers. And so it kind of offloads, it's not full encompassing, I should say. Having both receiving facility, emergency receiving facility, diversion center, stabilization center is all encompassing, one direction, then you allocate out to the community in terms of resources. 75 to 80% less than serving the same population in the jail. Of course, the diversion center improves recidivism rates, faster turnaround times for police units. Of course, bringing someone to the jail is not an overnight process. It is an overnight process, but of course, the booking, the making sure that that person is fit for incarceration, that's a whole nother process versus bringing them to the diversion center to get them the appropriate care. From a medical standpoint and clinical standpoint, stabilizing a person is really #1 if you want them to stop committing the same crime. Having them understand what that crime is, but having them mentally stable or stable at a therapeutic level really starts to help them identify what they're doing, what crimes they're committing, and why the crimes are serious or bad. And then, of course, your focus is on treatment and stabilization. The jail, our focus is on care and custody and control. The diversion center, the emergency receiving facility, their focus is on treatment and stabilization. And that's pretty much all I have.
Great, thank you, Director Barton. Commissioner Johnson, any other questions, comments? Okay. Zach, do you have any
I get it.
thoughts? But
Get it.
okay. And then just one comment about the faster turnaround times for police units. So I have heard from police and county and cities that depending on what time of the day or what's going on at the jail, a unit might sort of be held up there for an hour, maybe more. Just sort of they have to kind of babysit until someone can kind of go through the process. So,
Absolutely.
I think to me that was another opportunity for us to address capacity because, and Zach, you know this, I mean, we've fully funded every police position since I've been on the Board of Commissioners, but hiring and filling those gaps is another issue.
Sure.
And so, if an officer or a unit is taken out of the capacity, to recall, the wall time, so to speak, for that, then it's just another example, way for us to try to improve efficiencies, even if it's just 20 minutes here, an hour there, right?
Yeah.
When you're on those tight margins, it really does require us to think at every little slice of efficiency.
And that's a little bit of what's going on, why we're taking a little bit longer. You bring a patient in that is decompensating or going through a psych episode, we still have to do that evaluation at the intake area to understand, okay, are they fit for incarceration?
Yeah.
Are they having substance? Are they coming off of fentanyl? Do they need medical clearance? The diversion center can provide medical clearance. They can provide all of this versus just staying at the back door waiting. And then we still might end up sending you to a hospital for, clearance. Even if it's just a criminal trespassing charge, you may still be sent to the hospital. That police officer is still tied up. The arresting agency is the one taking them to the hospital, not the sheriff's office.
Okay.
Yeah.
Commissioner Johnson.
So, and to that end, of course, that is bad for the DeKalb PD, but it's really, really tough for our municipalities, especially our small municipalities. Some of them might only have 3 officers, 2 officers on a shift at a time. So if one of them is out at the jail for hours on end, trying to get an inmate into the system, that time and that patrol time is down, and general community can be a lot less safe during that time.
Absolutely.
Yeah, and me and Commissioner Johnson know that Clarkston, Stone Mountain, small areas,
Stone Mountain has 3 officers per shift.
Yeah.
Yeah, exactly. So when one leaves, then this, it really cuts it in half or a third. Judge Jacobs, anything else you want to say?
Yeah, if I can, just for a moment, I don't know that anyone's really talked about the various lanes here, so I'd like to do that just
Sure.
for a second so that we're kind of clear where everyone operates. I would kind of conceptualize all of this as 4 different lanes, 2 of which are judicial lanes, and 2 of which are not. The first lane is the policing, the law enforcement lane, and there's been quite a lot of discussion about diversion programs before someone before someone is even booked into the jail, before a warrant is taken out. All of that. That is very much a law enforcement lane. So that would not be where the judiciary is operating. After a warrant is taken out, defendant gets a bond. That is a judicial lane. So, and I'll talk about, we, as you, the commissioners know, we are right now have an active accountability courts committee working in state court to set up, in particular, a new mental health program. And actually, the mental health resources that we marshal, as part of that effort, can actually operate in both of these lanes. But the second lane is after warrants are taken out, defendant gets a bond, and a state court judge then has to touch the case in terms of making bond decisions. That is a judicial lane, so we can set special conditions on that bond. As I noted, one of the challenges there is that there is an ever-growing list of bail-restricted offenses that require a monetary bond, so we're not always able to grant a special condition with a UJR bond, with a UJR order to release someone on their own recognizance. But but we can impose special conditions that involve treatment. Another challenge in that lane is we do have an excellent pretrial services department, as I mentioned, that operates out of magistrate court. If we were to expand judicial supervision in that lane through using, for example, pretrial services, the resources don't exist right now to do that. So that we don't have the resources. Pretrial services also serves the Superior Court, so a lot of defendants with felony bonds are supervised by pretrial services, and pretrial services reports to the judge. We don't really have resources at our disposal to judicially supervise defendants, release a larger number of defendants released on bond in misdemeanor cases where the judge might want to supervised treatment, for example. So that's one area that we need to work on is getting resources that enable us to spend more time as judges with the cases where we have required treatment as a special condition, and also as a special condition, we would like to be able to check in with the defendant on a regular basis. So that's actually two special conditions there. One of them is getting the treatment, and the other is checking in. Okay. The third lane is not a judicial lane, and that is that's post-accusation, when a defendant then goes into a diversion program. As you're aware, we have an excellent misdemeanor mental health court that the solicitor's office spends a lot of time working on and is run out of magistrate court. So there are magistrate court resources involved there. Those are cases that are in front of us, but ultimately the decision to participate in that program is a decision between the defendant and the solicitor's office, and it's a decision that informs whether the solicitor's office decides to go forward in prosecuting the case. Obviously, the defendants there tend to be defendants who can make an affirmative decision that I would like to avoid having a misdemeanor charge in return for getting the mental health treatment that I need. Tends to not be the type of defendant that we are talking about here. Yep. The final lane is an accountability program. So that would be post conviction, pleading into a program. Okay. And that is a judicial lane. That's a lane where the judge would be actively supervising the case as part of the conditions of probation. One of the challenges there, frankly, is simply, first, we need the program. We actually don't have a misdemeanor mental health accountability program in DeKalb County currently. That is one of the things we are working on. And some of the same resources that are used here can be used in the second lane, I would think. But the challenges there are sometimes competency challenges, and Director Martin pointed out, the DBHDD process of restoring a defendant to competency. That process, as he pointed out on his slide, takes longer because of the strain on state resources, takes longer than we have in a misdemeanor case. Misdemeanor cases, each charge is a maximum of 1 year in custody or a maximum $1,000 fine. That's not relevant here, but the point is that, what is it, 400 some odd days? Yeah, 467 days to restore a defendant to competency. That is longer than the term of a misdemeanor sentence, so that is not a resource that is available to us. I will compliment the Public Defender's Office in DeKalb County. They have some attorneys and social workers who do an excellent job working with defendants who have mental health issues, severe mental health issues, and getting them to a point where they can at least understand the process enough to take a plea. From my standpoint as a judge, when I put a defendant under oath, I have a series of questions that I ask them in taking a plea, and I'm just at that point looking for pertinent answers to the questions that I'm asking. That is a defendant, generally speaking, who is competent to take a plea. And there are attorneys and social workers in the public defender's office who are very good at getting a defendant to that point. If we can get a defendant to that point, then there is the possibility of having them plead into a mental health program that would be judicially supervised. One thing I will add to all of this is that, so like I said, there are really 4 lanes we're talking about. 2 of them are judicial lanes, lanes 2 and 4. 2 of them are not. And I've learned to stay in my lane as
Yes, same.
as a judicial stakeholder. So, and that's important. I mean, that's the accountability programs are legally set up to be judicially supervised. Diversion programs are legally set up to be supervised by the prosecution. I mean, that's how our system works. But we are. One of the things we are planning to do, so at our last accountability courts committee meeting of the state court bench, we did hear from Claritel. We are looking at taking, I mean, granted, they're talking about, the programs in Houston and San Antonio are diversion programs, but a lot of the resources that are used there are resources that we can use in the second lane and that we can use in the fourth lane too.
Okay.
So we are actually looking at taking a delegation of judges to Houston and San Antonio to see those programs for ourselves. So we are actively working on setting up a proposal to build up the second and fourth lane to address some of these cases. But really, it is going to take a multifaceted approach across all of these lanes to truly tackle the issue.
Yep.
There are going to be defendants who, end up with an accused case who are repeat offenders on criminal trespass charges and other charges that are really wrapped up in issues of mental health, substance abuse, indigency, homelessness. We're certainly going to, no matter what, see some defendants in that lane that need the treatment. So we've got to work across all of these lanes.
Great, thank you for that perspective, and I think that's where we want to lean on you and state court, magistrate, solicitor, and public defender to, to basically tell us what would support your lanes, and so I think one of my top priorities is, and Zach, this is just for us to work with the administration on, is how can we begin the planning process for standing up something that would be a separate facility. And as we work towards that goal, understanding how your lane will intercede with that, refer that, or support it, right? So that's just and helping us understand. And so I think y'all be invited to participate in these conversations, and certainly would welcome your feedback from Houston and San Antonio if you learn anything out there. And again, I think about it in terms of like the facility itself, in terms of the services, and then where there might be some overlap between your process and then what we're doing. Because I think, as we pointed out here, there's pre-arrest and then there's post bond. Mm-hmm. Okay.
Thank you.
Yeah. Thank you, Judge. All right. Zach, anything else on this?
Definitely appreciate the thought and effort that's gone into it. It does sound like the type of thing that would definitely complement a lot of what we're talking about, because this is a group of folks who are just going to be in that revolving door unless something different is done.
Okay. So what would be your suggestion of how we move forward, more conceptual elements? Because I think,
Maybe a little more conversation.
Oh, turn your mic on, Zach, if you don't mind.
Apologize. Yes, I think a little more conversation certainly with Director Martin, with Mr. Vander Merwe and others, Dr. Ferguson, of course, and just kind of talk through, what would this look like? What would a reasonable timeline be, and, location, those types of things. But it's definitely this is very topical. This is something that we've been looking at in some form and fashion. So let's just see where we can go with it.
Okay.
If there's, if it's possible that any parts of this could be either included in this upcoming budget. It's not now, so it would require new money, of course. Mm-hmm. Or there may be other funding sources that we could use that may help offset some of these costs.
Okay. Mm-hmm. Okay, great. Well, let's work on that over. Yeah, exactly. Yeah, I think that's a great point. So, Commissioner Johnson, I think one approach for the committee's purposes can be to, one, we could just schedule kind of regular check-ins throughout the year on sort of where we are with this planning process. But certainly, Zach, I think it's okay for any committee members, to be involved in these discussions behind the scenes with the administration, just, since this is our jurisdiction. So I want to make sure that the FAB committee members, are at the table and are helping try to make sure we're addressing all of the concerns or components they might have. And so hopefully we can, build consensus on how we move this forward. Does that make sense, Commissioner?
That sounds good. I think it is good to have probably at least quarterly discussions and updates on progress and, just a check-in all together on how everything's running. So I think that would be good.
Great. Okay, awesome. All right, thank you, Judge Jacobs. Thank you, Director Martin. Appreciate y'all's time. And we'll be talking real soon about the next steps, okay? Thank you. All right, Commissioner, we only had one other item I put on the agenda, and that was my item on 0158. So since it's my item, I'll hand the gavel over to you.
Sure. We are District 6 item 2026-0158. Commission Super District 6 to approve a resolution to establish a DeKalb for the People AI Tech Dividend Fund and Fiscal Stability Policy. Commissioner Terry.
Great, thank you, Madam Chair. Zach, I did introduce this at the end of last year, and part of the reason why I introduced this resolution was really around some of the concerns that community had around data centers being built in South DeKalb and not receiving any of the financial benefit from them. And so this was something that, in my sort of own personal view, would like to see any future revenues from a data center, if they're ever built in DeKalb County, that there would be some reinvestment in the community. And so what I'm trying to do here really is just a fiscal policy statement. And I tried to be sensitive, Zach, to the CEO's goals of not only increasing the rainy day fund, but also just delivering the core services. And so that's why you see that 25-25 sort of split. But again, I'm open to other percentages. I just thought, there would be a general sense of at least 50% of the future revenues would have sort of a focus on some of these key areas, which revolve around energy equity, so direct utility assistance, support for WorkSource DeKalb. That's part of the issue of AI and data centers is the job transitions that are happening, and then anything else that might be infrastructure related, particularly in areas where there are the qualified census tracts or other sort of environmental pollution or other negative development consequences. So that's the general idea. I think that just the one data center that is proposed, I did ask the tax assessor to just, ballpark sort of based on what they see in terms of like typical comparable data centers, how much value they add to the tax digest. And it kind of, went between $1 billion and $2 billion, sort of depending on what size it was. And the revenue calculations were about over $20 million annually. that would come in just from one large-scale data center. So, I think the reason why, Zach, you're seeing a lot of communities that are approving data centers. In fact, actually, I think we heard from one county, I think it was a small county, that said that I guess they cut all property taxes for homeowners because they receive so many new revenue sources from the data centers. So that's kind of, what's been percolating out there. But I did have a lot of residents that were concerned that we would take the money and we would, spend it elsewhere in the county. And, I'd like to think that we would, target areas that have them at the highest need. But this resolution is just designed to sort of codify that investment. So I'll pause for any questions or comments.
Microphone. Has the administration had an opportunity to review?
No, I'd like to spend some time with this, but just real quick, so is the concept similar to including data centers in a TAD?
Well, so the TADs are different because those funds don't come to the general fund. So I don't believe if there was a data center built in a tax allocation district that this resolution would apply, because this is only applying to the tax funds that are received, through the general fund. Whereas I believe the tax allocation districts are sort of, they're segregated, right, for decide
Right, the
CAB.
funds stay in the TAD.
Yeah, I think that's just, correct me if I'm wrong, that's sort of the mechanism, right, Attorney Phillips?
It is.
Yeah. So I don't think it would apply for tax allocation districts.
Okay. All right, so if I could spend some time on it.
Okay.
Attorney Phillips?
Well, COO Williams is going to spend some time digesting it. I was just going to try to help. I understood his question to be, by analogy, Commissioner Terry, these are going to target those funds in the way that a tax allocation district targets the funds when collected. And in that sense, I think there is a fair analogy here.
Okay. Gotcha. Okay. All right.
Do you have anything else, Commissioner Terry?
No, I'm happy to keep this item sort of deferred until the administration can review. I do think it would, Zach, I think it would help us in our other conversations that we have to have in May, because the data center text amendment was deferred to, I think, the second meeting in May, or maybe the first meeting in May. And that, to me, that was just one holdup that I was having. I think community members were skeptical of, if we allow data centers via the text amendment and then they get approved, through whatever process, SLUP or otherwise, that, where does the money go? And so I think if there was an agreeable investment ratio that would give our community at large, but certainly the ones that might be, near a data center, that there would be commitments from the county to
Sure.
to support their needs.
Yep. So we'll react in the next 2 weeks. By the
Okay.
time we come back, yeah.
Yeah, I think we'll probably have to defer this to the March meeting, because I think
Right.
we're going to be so busy with budget discussions.
I was going to say at least a 30 to 60-day deferral. If we
Yeah.
have till May for the moratorium and the
Yeah, I
text
think,
amendment. That gives us a little bit more time, but we do need to get through the budget.
yeah, so maybe if we could defer this to March 24th,
Is your
if that
motion?
works for you, I'll motion to defer item 0158 to the March 24th BOC with a stop back in FAB.
Chair will second. All in favor?
Aye.
Aye. I will hand the gavel back.
All right, thank you. All right, that is all of our agenda for today. Zach, tomorrow we have regular scheduled FAB. I think we have a few of the constitutionals coming in to present on their budget requests, and then I think we wanted to maybe, if we have time, begin going through just the budget in general for all the FAB-related departments and constitutionals. And then and I think we have a special call FAB scheduled also the 18th of February, and then the day before the final BOC meeting in February. So we're trying to give ourselves enough time to, let all the committees have their budget discussions. The final budget recommendation comes from FAB. So hopefully I know it's like right in the middle of NACO, so we'll be at NACO till Tuesday, so we got to come back on Wednesday.
Okay.
But you don't go to NACO, so you're fine. You're good. So I think most of us are flying back Monday, Tuesday. So will there be any opportunities for the requests that came in from the commissioners at the end of last year? When should we begin to talk about those?
Certainly by the 18th, we'll be prepared, but I think we have gone through the overwhelming majority and are prepared to make recommendations as it relates to, and I see two buckets. There's kind of operating costs, and then there's capital. So we're
Right, CIP. Mm-hmm.
Right. So the operating, we're much more positioned right now to present, here's what we would recommend and how we would recommend paying for it.
Okay.
The capital is within the broader capital conversation that'll probably come, in the middle of March or something like that.
Okay, all right, so and that's the 5-year CIP plan?
Exactly.
Okay, all right, gotcha. All right, so any CIP projects, we'll still talk about them, but
Right.
the posture is that that's going to be part of the larger
Right.
5-year package?
Absolutely.
Okay, gotcha. All right, Commissioner Johnson, any other questions about that?
Nope, I'm good.
Okay, all right, I'll take a motion for adjournment.
Move to adjourn.
All right, second, all in favor? Aye.
Aye.
All right, meeting adjourned. See y'all tomorrow. Thank you.